Hello, my name's Amy. I am a physical therapist in the state of Indiana, and yes, that's a Mickey balloon behind me. I'm just going to give you a quick little rundown of what physical therapy is and what physical therapists do and why you might need to see one. So at some point, your rheumatologist might recommend that you see a physical therapist or you go to physical therapy. A physical therapist is a healthcare professional who uses techniques to help you improve pain, joint movement, and just general quality of life. You might see a physical therapist, for example, to improve your knee motion and flexibility after having a difficult flare that involved a lot of knee pain and swelling. So physical therapists help people heal from and manage chronic illnesses like JIA. But they also help coach people on staying fit and active after dealing with something like this, such as after a flare sort of dissipates and heals. So the therapist would also help you maintain good strength and flexibility of your knee joint to make sure that you can participate in all the activities that you want to participate in, and then also to give you the best opportunity for keeping your joints healthy. So if you go see a physical therapist, what should you expect? Well, first the therapist will do an evaluation, which looks much like just a general exam. It'll involve asking you questions to best understand what's going on and how you're feeling, if there's anything that tends to make you feel better or make you feel worse, and to understand what you're having trouble with due to pain or movement difficulties. The therapist will then examine your affected joints, and this looks a lot like what your visit to the rheumatologist looks like. The therapist will assess your strength, range of motion, and flexibility of all those affected joints, maybe take some measurements. And then the therapist finally will then set goals to help you improve strength, range of motion, and pain, and anything that was found on that exam to be affected, and to help get you back to doing the activities that you love. So depending on what you need and what the therapist determines during the evaluation, you may end up only needing to see your therapist once or twice. You just might need a little advice on exercises that'll help, but you also might end up needing some more hands-on techniques from the therapist to help, and that would mean going maybe, let's say, at least once a week for a little while. The ultimate goal, however, is always to not need to go into the physical therapy clinic as much, at least not on a regular basis, and be able to sort of maintain your joint health at home. Very often this involves continuing some simple exercises that the therapist will give you that you can do pretty much anywhere. But the most important thing to all physical therapists is that we help you get back to where you want to be. And so we always want our patients to tell us how things are going and if they feel like we're missing something important, or especially something that's important to them. And always ask us questions if you have them. That's what we're here for. Take care. Bye-bye.